Thank you very much, Presiding Officer. First of all, I want to just get a highlight. I'm going to take this debate. I'm going to speak about a different perspective in the issue that we face. Firstly, I do think it's important to acknowledge that improving health and social care outcomes for patients relies upon two things. First of all, ensuring that those who require these services can access them, regardless of income and location, and also ensuring that the workforce are supported to carry out their jobs. Now, the Scottish Government has already expanded free personal nursing care to everyone who is assessed as needing it, and the National Care Service will go even further. The publication this week of the National Care Service Bill will see a national wage for carers to ensure the value of the wages of our social care workforce better reflects the work that they do. However, we need to consider how the continued impact of the pandemic and now the cost of living crisis, as has been indicated in the Labour motion in front of us, is actually impacting health and social care staff. As fuel pump prices soar, people who rely upon their own transport for work, like carers and home care staff, are having to absorb the additional cost of fuelling up. And that's why I have written to the Chancellor of the Exchequer asking for the mileage rate to be uprated for health and social care workers until such times as that fuel price actually does reduce. The 45p rate is set at UK level, and if the Chancellor were to provide a limited, focused measure to increase the 45p mileage rate, it will have a positive impact upon my constituents, those constituents of every single MSP in this chamber, and also across these islands. Now, Willie Rennie and Alex Rowley spoke in the early debate about targeted measures. Now, what I'm proposing is exactly that. It needn't be a constitutional matter. The idea came about at one of my regular surgeries when Frances Poole came to raise a range of issues with me. Frances is a home care worker and receives the 45p a mile, which has said that this was covering less and less of the fuel that she needs to visit patients in their homes, never mind the wear and tear of the vehicles of home care workers. Now, we all know that staff recruitment and retention is an issue in the social care sector at present, largely due to Covid-19 and also in some areas Brexit. Without an increase in the standard mileage rate, I do fear that some social care staff may actually have no option but to look for employment elsewhere if they cannot afford to get to work due to the fuel costs. It also makes it harder to recruit more staff. Presiding Officer, my Greenock and Inverclyde constituency will be one of the hardest hit constituencies affected by home care challenges. Inverclyde has an older population, and it has a growing older population, and this is forecast to continue for up to the next 2 decades. Improving the working conditions of non-residential home care workers is absolutely vital. Now, Christine Graham was correct when she spoke in the earlier debate about decreasing the VAT rate, saying that that was a sticking plaster. I agree with her, and I accept that the mileage rate proposal that I'm putting forward is also a sticking plaster approach. However, the home care workers cannot wait until Westminster fundamentally changes its funding approach. Presiding Officer, the government, this SNP government, have taken a number of important steps to actually improve social care through the introduction of the Health and Social Care Integration, Self-Directed Support and the Carers Act. In addition, on the 1st of April 2019, free personal and nursing care was expanded to everyone under 65 who was assessed as requiring it. Now, many measures have been undertaken, but clearly there's still much more to do. If we do genuinely value our home care workers, and I genuinely believe across the chamber we all will, but the Chancellor has an excellent opportunity to actually make a change, a fundamental change that could help home care workers across these islands now. Thank you very much.